Boutique and Concierge Medical Practices by Meaghan and Alyssa Benoit. So what exactly is boutique and concierge medicine? This is a medical practice mainly found in primary care facilities that has risen from the demand created by overpopulated medical centers already existing. In this, doctors work in their own care and charge an outside fee separate from insurance for their visits. This can be annual, monthly, per visit, or a mix of the three, and they are not reimbursed by any insurance companies. This annual fee can range anywhere from $40,000 and above. This medical practice primarily services people in higher economic statuses, as this type of practice is extremely expensive and must be paid directly to the doctor without help from any insurance company. The physicians choose a few people to help and they become their personal doctor, including at-home care, in-office visits, tests, medication, contact with a specialist, or in-office procedures. But this does not cover hospital fees or the fees for the specialists themselves. Through this, their job is to provide any and all services the patient needs or wants for the yearly price they must pay. There is a rough estimate of 5,000 to 20,000 boutique doctors in the United States. This accredits for roughly 1% of the actively practicing physicians in the United States today. The reason why there is such a large gap between the two values provided is due to a lack of federal registry or official national database for practicing physicians. With this, most boutique and concierge doctors do not advertise their practice online or through any advertising and must be heard about through word of mouth. These practices are usually privately owned, with one or a handful of doctors who operate and run the practice. There are also a variety of people who work to make sure these systems run properly, such as physician assistants, patient counselors, and nurses. Physician assistants can take over the role of a doctor in certain cases, such as filling in for an at-home call, being an advisor to their patients, doing some day appointment for acute cases, or overseeing operations. The patient counselors make appointments and organize patient medical files and help the doctors keep their schedules in order. The nurses help the physicians collect information about the patients and take the vitals for the physician per visit. But nurses aren't necessarily always used for this, and they can just be used to dictate what happens during visits while the physician assesses the patient.
So some of the benefits associated with the boutique and concierge medical practices are what these patients pay for and what draws physicians into joining the business. Patients pay for a variety of services like personalized treatment plans according to their personal health history, which ultimately comes from the one-on-one time they receive with their physicians as well. And because there's such a small clientele, there are short wait times given to the patients because they pay for these doctors out of pocket, and they can even take use of 24/7 contact with their doctor. And this helps benefit the physicians because they don't have to deal with insurance companies, and they make more money because of the fees that they charge. And they can even have their own practice. The limitations are still there, like only a few people can go to a boutique doctor because of the limited supply, and the high out-of-pocket fees are usually super expensive, upwards to the thousands of dollars. Being a patient of a boutique doctor also means you'll need other ways of paying for specialists and hospital visits if needed. And even the physicians have some drawbacks. Because they provide so many catered services, they're always on call, and they have to provide transportation for home visits if necessary. So there are a few examples that can be found, but some of these practices can only be found through word of mouth. The Griffin Concierge Medical Group in Tampa is an example that has a website to advertise their services. The practice was founded 10 years ago by Dr. Radley Griffin, and they offer many services that range from general care to cryotherapy. They have a family-oriented approach to their patient, and each doctor at the facility can only have a maximum of 300 patients. And then an example of those who don't have a website is Dr. Schlane's Private Medical Group. They have an article posted on New York Times expressing the importance of what concierge medicine is and its benefits and drawbacks to inform their readers on the topic. This group takes even less patients per doctor than Griffin, and they cover about the same range of services as Griffin does, even making appointments with specialists around the country to help service their patients. And the cost of Dr. Schlane can range from about $40,000 to $80,000 annually per family of 4. And this all depends on what's needed per family and what all the family is wanting out of the doctors as well.